All right, so my name is Trey Ostrom. I did the healthcare comparison of the United States, comparing it to Japan. So, going to slide one, the overview of Japanese healthcare. They have a social insurance where everyone must sign up through work or community plans, meaning they need to sign up for the insurance one way or another, and the government pays for what patients can't. The hospitals and clinics are private. Going to slide three, the overview of U.S. healthcare. So, with the exception of a few government programs, the U.S. healthcare system is primarily private. People often get their own insurance through jobs or pay expensive premiums. And while the government does cover some of it, it's under certain acts and for specific people, and there's a very large gray area. So in Japan, the insurance structure, most bills are covered by insurance. People choose their plans according to income and employment. The individuals can see doctors more frequently without worrying about expenses. And oftentimes, I do believe that people in Japan visit the doctors 3 times more often than US patients do. Now, the insurance structure in the US, the insurance plans determine coverage. The Americans pay premiums, co-payments, and deductibles, which all vary depending on what plan you have. Preventive treatment is less popular due to expenses, which the insurance covers some of it, not all of it, and it leaves people in financial debt, which doesn't happen in Japan because the government pays for it, which we'll get to that. But people often put off visiting the doctor because of cost. So the advantages of Japanese system is that nearly everyone can afford the care. Cost is very affordable and covers everyone. Patients can choose any doctor since prices are fixed and doctors can't overcharge care. So patients go into any doctor, the prices are fixed. It's determined by, I believe it's a committee. And if doctors overcharge, then the doctors will go out of business because nobody's going to go visit them. So the advantages of the US system, it's a high quality care. Hospitals are equipped with cutting edge technology, and patients are free to select the facilities and doctors they want. So it's a high quality care for a high price, and hospitals are always evolving and finding new innovations for their technology. So the governmental role in Japan, the government sets prices for medication and therapies. The doctors will lose patients by raising prices because they can simply go elsewhere, meaning the patients can and will go elsewhere. The government keeps the healthcare prices down. Now, the governmental role in the United States for the disabled, elderly, and those with low incomes benefits from government programs. Without the government assistance, healthcare costs are high since hospitals and physicians determine the rates. Financial challenges in Japan. Hospitals struggle financially. Hospitals and doctors make very little money because of fixed costs. And due to lack of funding, hospitals are in deficits and closing. So hospitals are closing all around the countries like flies, and they're becoming less and less common. And doctors and hospitals go through a lot to get the care the patients need, and so they feel underappreciated as well. So that can lead to a decrease in doctors going to study for that, like college wise, education wise, more so. Now, the financial challenges in the United States is that hospitals make a lot of money, which is the exact opposite. patients receive massive bills even with insurance. Patients without insurance may not visit the doctors because of the steep prices, and long wait times can make issues become larger. So patients will put off going to the doctors because of the steep pricing, and they think they're fine because there's no symptoms, but in case you don't know, symptoms can be invisible and evolve in your body and make it worse. So usual checkups with the doctors makes it more preventable, but because of the price, they don't go at all. Now, the hospitals make a lot of money because the government doesn't regulate the prices, so the hospitals can make their own money or set their own prices, and they set insanely high prices, so the patients have to pay out of pocket despite the insurance, because the insurance, despite the high premiums, deductibles, or co-payments, despite all those being expensive, they still don't cover all the bases for the care that's given. Now, comparing the two, Japanese citizens see doctors about 3 times more than Americans. That's annually. And this helps patients catch problems early on. And I do believe that the Japanese government will check up on citizens if they go too often because of healthcare abuse. Although that might be a different country I'm thinking of. Now, the Americans receive high quality care but wait longer. Americans may put off visiting doctors or skip visits because of the cost. So while Japanese citizens have low costs, American citizens have high costs, and that's why Americans push off visiting or don't visit at all. Now, Americans receiving the high quality care comes from the high costs that hospitals receive. So hospitals pay off their doctors and nurses, but they still have money left over to invent more and find more procedures. And with the Japanese hospitals, they have a fixed price, and so that price it varies from the government, and the government gives funding to the hospitals, but it's not enough to keep the doctors or pay the doctors enough and make the hospital enough money. So they end up shutting down because of the money difference. So overall summary, Japan gives cheap universal health care, frequent doctor visits, hospitals struggle financially, while the US has advanced high quality care, various choices in doctors and care that the patients can choose, but patients struggle financially and can't afford healthcare overall. These are the references that I used, and thank you.